Welcome to this week's episode of Ask Dr. Jessica. I'm so excited. We have the best guest today, my good friend, Michelle Kelman. She is a pediatric dentist, and she's been working in private practice for over 15 years, and she has so much wisdom to impart, and I'm so excited to ask her the most common pediatric dental questions that I get, and hopefully you can learn a lot, which I actually know you will. So welcome, Michelle.
Thank you. Thanks for having me.
So Michelle, tell me, what age should a kid see a pediatric dentist? Should they go right away as soon as those first teeth come in? Should they wait till they're older? When do you like to see kids in your office?
So the American Academy of Pediatric Dentistry, the AAPD, recommends that a child come to the office no later than 12 months. That being said, it's usually because at least one or two teeth have come in by then, and we can review what's called establishing a dental home. So we can evaluate the shape of the mouth, the consistency of the enamel of the teeth. We can also review oral hygiene. We can go over nutritional recommendations, fluoride recommendations.
Now, answer me this. When should a child start having their teeth brushed? When those first two teeth come in, is it really important that those teeth are brushed? When do you think brushing should be started?
So taking care of the mouth should be started even before the first teeth come in. So for example, with bottle feeding, with nursing, you want to make sure that you, as often as possible, have a wet 2x2 gauze or a little pre-packaged spiffy, if you have one on hand, to wipe the gums from any milk that's left on them. And as soon as that first tooth comes out, there should be brushing at least twice a day, preferably with a small toddler brush, if your child is open to it or if you're open to the challenge, and making sure that all liquid and food is removed from the area.
Okay. And from the get-go, do you recommend brushing those teeth twice a day?
Absolutely.
Okay.
In the morning, either after the first meal or after the first milk, and at night before bed.
Okay. Now, a very common question that I get, a lot of parents tell me that they have a hard time getting their child to open their mouth for brushing. And I went through this with my own kids, that we tried to get the brush in their mouth and they would keep their lips sealed so tightly, it was hard to brush. Do you have any tips for parents for helping their kids get excited about getting their teeth brushed?
For starters, I always tell parents from the get-go, shadow it. So make sure that you're showing them that you're brushing.
Okay.
Whether you're brushing in the kitchen, or you're brushing, in my case, in the car, or you're brushing in the bathroom, make sure that they see you with that toothbrush in the mouth. And at the times it's time to brush, from the beginning, you should be brushing as well. So brush first. If it's not a mystery and you're not coming at them, then they're more open to brushing, especially if the toothpaste tastes good.
So you're saying instead of coming at them this direction from the front, if you come behind them, it's less intimidating?
Exactly. Okay. And you can, you hold their head, not like this, but nurture them. Hold the head here so that you have good control so the toothbrush doesn't go into different areas. And bring the toothbrush here, hold down the lip, and brush in little circles.
Okay.
And that makes all the difference because it's something that they saw you do, and now they're watching themselves do it as well. So there's no secrets, there's no surprises.
Okay, that's a great tip. So modeling first, doing it as a parent, brushing your own teeth, and then in front of a mirror, coming behind them and aiding them in brushing their teeth. Is that right? Okay. Mm-hmm. And okay, and then in terms of what type of toothpaste to buy kids, a lot of parents will ask me whether or not it should have fluoride or not. And this is something that I would love to clear the air with you about, because when I first started in pediatrics, I would hear that we want to avoid fluoride until children can spit. But then later I've read that a little bit is okay, a little bit of fluoride before they can spit. What type of toothpaste do you recommend? Should we be looking for fluoride or not? What's your take?
So not too many parents are letting their children drink tap water. And in so many homes now, even if there is tap water, which has the fluoridated water in it, specifically in California, in Los Angeles, then they're getting filters for their water. So reverse osmosis, carbon filters, charcoal filters. And as a result, there's no fluoride in the house at all. So in order to provide at least a little bit of fluoride to those developing teeth, it is important to have a toothpaste that does have fluoride in it, preferably one that has a seal from the American Dental Association. And if it's a child who really can't spit well, we have to think of it as a coating for the teeth, what we call topical protection. So you just use a right size on that toothbrush and massage it onto the tooth. If they take a toothbrush and squeeze the toothpaste all over it, yeah, that's bad. We want
to endorse a brand, but is there a brand that you like? Because a lot of parents will tell me that the toothpaste is too minty for their kids.
Right.
What brands do you find are most successful?
So without endorsing any brands, I have found that kids do prefer gels.
Okay.
So if it's a gel-like toothpaste that also is not one of those that's bright pink or bright blue, because those tend to be sharp. And most kids right now are not having artificial food. You're not going to have too many kids drinking high C or Hawaiian fruit punch. So they're not used to those sharp flavors that are found in a lot of the bigger brands that have those bright colors in them, that have watermelon flavor or fruit punch flavor. They actually don't like those. They say that it's spicy, even though it's not mint. So I prefer the natural brands that are gels that do have the ADA approval on them. And if you are going to then graduate to one that is like a paste, then there are quite a few of the more natural organic brands that do have fluoride in them, but also don't have all that added flavoring and color.
I never even thought to distinguish between a gel and a paste for a toothpaste. So a teething gel initially. Okay, yes. This is great. I love talking about teeth, by the way. We could talk about teeth all day.
Oh, perfect.
I love it. Okay, so now what about flossing? At what age should we start flossing our children? Is it from the beginning, or when do you recommend making that a habit?
So they need to be flossed as soon as the teeth are touching. I call them kissing teeth. Once the teeth are kissing, we have to floss them.
Okay.
And that's because food gets stuck in between. So even if you have a low sugar diet with a perfect oral hygiene, if food is getting stuck in between the teeth, then that can form cavities. So I always say floss first and then brush. But it's a good idea to start flossing as soon as the first tooth comes out, just around the little tooth, more as a training course so that they know the floss is coming later.
Okay.
Usually the second molar's in after 2, and that's when our kids start getting a little bit of attitude.
Okay.
So that's not the best time to introduce something annoying, specifically at the times of day when they're the most annoyed, first thing in the morning and right before bed. So you might as well make that a habit right away.
All right. Now, you said something really interesting to me, because it sounds like I'm doing it all wrong. We should floss first and then brush? Because I admittedly will brush and then floss.
I can tell you in dental school, there was quite a few people that were very, very concerned about this. Oh. But we want fluoride in between the teeth.
Okay.
And if not fluoride, then let's say you're using a toothpaste that has tricalcium phosphate or any other form of mineral that's strengthening the teeth. You want it in between the teeth, and if food is blocking it, it can't get in.
Okay.
So for that reason, if you floss first, it can get inside and it can strengthen that enamel. Same thing with mouthwash. I always tell patients, if you are using a mouthwash for reasons, for example, if a child has puffy gums and it's not a fluoridated mouthwash, you still want it to get into that gum region right in between the teeth.
So you would recommend flossing first and then using the mouthwash?
Floss, brush, mouthwash.
Okay, floss, brush, mouthwash. I'm going to say it over and over again.
And if you're having one of those nights where brushing is just not going to happen,
yes,
I'll tell parents, floss, take a Q-tip, dip it in the mouthwash, rub it around. Washcloth, toothpick, Q-tip, rub it around.
Okay.
Just make your life easier, but get the job done.
Okay, I like this. All right. Now, just to talk about every parent's fear, and that is hearing that our child has a cavity. What do you recommend beyond brushing to prevent cavities? Is there a whole lot parents can do? You know, is avoiding juice and candy that important? What do you recommend as a dentist as tips to avoid cavities?
So in an ideal world, our children are flossing
Yes.
twice a day, brushing twice a day with the fluoride toothpaste, using mouthwash, and avoiding all sugar and high starch snacks. But we don't live in an ideal world. And if you're that type of parent, I will personally take your children away from you. So
Too
for at least
perfect?
a day of fun. But that
Too controlling?
right.
Yes.
But that being said, you want to do as much as you can. So yes, oral hygiene is key. Flossing, brushing, mouthwash, or at least flossing, brushing with a fluoride toothpaste, extremely, extremely important, because you need the teeth to have the ability to, and the gums to be clean. But the teeth need to remineralize after a day of being demineralized.
What does that mean exactly?
So what that means
You
is
say
throughout
demineralize.
the day, with spit, with carbohydrates, with sugar, with food, with drooling, with playing a video game and going like this, their teeth are getting bathed in a way that is weakening them. So by adding fluoride on to a clean surface, you have now given the teeth an opportunity to again get stronger.
Okay.
And so that's really important. Now, it's easier for the mouth to maintain that cleanliness if eating and snacks are at a regular schedule. If you have a child who's having a bowl of Cocoa Puffs with chocolate milk in the morning and then brushes and goes and watches Sunday morning cartoons, you're okay. It's not great for the body, but you're okay. But if they're sitting there watching Sunday morning cartoons for hours with a bowl of Cocoa Puffs in front of them, the mouth doesn't have time to get rid of them. So the spit can't clear it. Your fluoride's not really doing much. So you need to make sure that you are removing the source of injury. Don't add insult to injury. Keep it strong.
So you're saying that if you're going to have sugar, which inevitably all kids do have some, it's much better to have it in a discrete, one time short period rather than snacking throughout the day. Is that right? Okay.
Right.
So if they're snacking throughout the day, it gives an opportunity for sugar to stay on the teeth without the saliva clearing it. Is that what I understand? So my next question is, in your experience, when you've seen kids with multiple cavities, what's the number, if you could list, a top 1 or 2 reason why they get cavities, what would you say? Do you think is it from snacking all day?
It depends on the age group.
Okay.
When I see a child who is extremely young, for example, today I was teaching my residents, I'm a clinical educator in a university, and I was teaching my residents, and an 18-month-old came in with a full mouth of decay. All 4 front teeth, black, rotted, and the back molars. We knew right off the bat that this child must go to bed with the bottle and probably snacks throughout the day. This was our assumption. And in addition, was probably born with a little bit weaker teeth than we would like, genetically speaking, or if something else was a factor. And so usually when we see really, really significant cavities all over the mouth in a younger age group, it's either from milk staying on the teeth all day and all night, lack of brushing, and diet. If we sometimes see just one cavity on a tooth and it's a pretty deep one, then we'll say, that tooth probably came in weak. This was just insult to injury. It came in weak and there was pirate's booty in there all day and it just never came off. And as they get older, that is also a factor. So for example, some 6-year-olds, when their molars are coming in, they come in really weak. And then you'll see their front 2 teeth and they come in with these white spots as well. And there is something that we call molar incisor hypomineralization. And those are kids that just are born in, or whose teeth erupt, in a way that's a lot weaker. So we have to seal them right away so that they don't just start rotting as they erupt into the mouth. Because we do get cavities that start forming under the gum if the tooth is too weak.
So, and this is something that as a pediatric dentist, you would notice and recommend to the parents to put the sealant covering on?
Right. And so if we see a child, for example, if it's just their baby teeth that are coming in really weak or that have a lot of those white spots, we're not going to necessarily seal the front teeth because we can't, but we can definitely provide a mineral supplement, whether it's just something that has calcium and phosphate minus the fluoride, which we do for kids under the age of 6 in a prescription form, or if they're over the age of 6 and can spit properly, then we'll give a stronger fluoride formula to them. And that's to really protect that enamel.
Okay. All right. So here's a big controversial question that I can't wait to get your answer. What do you think, electric toothbrush or regular toothbrush? Is the electric overrated? Is it worth it? Is brushing just what's most important?
Worth it.
Okay.
It's worth it.
The electric.
If you have spent a right amount of money on it, it's worth it. What I mean by that is if it's just one of those little battery brushes that happens to have a cartoon on it, it's not really doing much.
Okay.
But if it's a rechargeable electric toothbrush made by a respectable brand,
okay,
then it is making all the difference. It will sit on the tooth where the gums meet the teeth and brush that tooth 60, 90, 100 times. And that's not something that we can do manually. But that being said, I've had children that have started with the electric and just hold it there and nothing happens. And that's when we say you got to go back to manual, because if I tell children, if you lick your teeth and it feels like there's sand on your teeth, you didn't brush well. But if you lick your teeth and it feels like a hand on a kitchen counter, then you're in business. So whichever toothbrush can do the trick, but usually the electric will work better.
Okay. All right. So a good, reputable 60 times a minute.
Yes. With a timer, preferably.
Okay. Okay. How much time?
2 minutes.
2 minutes.
30 seconds per quadrant.
Okay.
Although with the little kids, I say it's in, it's out, it's over. It's just get in, get out, because I don't know any children under the age of 4 that are going to brush for 2 minutes. Just get every tooth and get out of there.
Just get the job done. Perfection is the enemy of the good in that situation.
Exactly.
Yes. Okay. And what about changing out the toothbrush head? Do you have a recommendation how frequently we should be changing out the heads?
Ideal number, every 3 months. I would say most parents say they're replacing them about every month to 2 months. So I do recommend a good membership.
Okay. And another controversial question. What are your feelings on pacifiers, thumb suckers? How bad are they really for the teeth?
They're bad for the teeth, but they can be amazing for the child. So it's a case-by-case basis. The main reason that as pediatric dentists, we sort of cringe at the thought of thumb sucking or pacifier is because if you imagine the roof of the mouth like tinfoil, and very often there's some fun restaurants where you leave and your food is prepackaged like a duck or a fox or something of that nature, the roof of your mouth is the same way. So if it's flat or a little bit curved and you put a pacifier or a thumb in there, it'll shape around it. When it shapes around it, it actually can open the mouth. So you have these kids that look like they have a bass mouth, for example. And the molars get really tight, which puts pressure on your jaw. The tongue gets pushed down, which is really unhealthy for eating and speech and other oral motor functions.
It gets pushed down from the thumb being in the mouth?
Right, and the pacifier. Okay. And you get kids who talk a little lazy when they're on it like this. And the permanent teeth are bound to start jetting out on eruption. So it's not all aesthetics. I do hear parents say, she'll get braces, don't worry about it.
Right, that's what I hear all the time.
But it's more of let's make the mouth as functional as possible. But it depends on the child. So if I see a 4-year-old who will not take the thumb out of their mouth, I know they're not ready. But if I have a 4-year-old who I can show with an intraoral camera that there is a thumbprint on the roof of their mouth and they're kind of icked by it, and we go through a whole series of fun ways to stop and the celebrations that it entails and the prizes and what a big girl they're going to be, then yeah, I'll start talking about it at age 4. But sometimes I'll start talking about it and I'll see the eyes water just a little bit and I'll stand back. I'll say, and that's why we're just putting it out there. And we'll keep looking at how strong your teeth are and call it a day. So it depends on the child, but ideally it's
So I think that's a great tip. So what you're saying is you're meeting the child where they're at. If they're ready for it, and you can give them positive reinforcement and encouragement, we'll encourage them to break the habit. But if they're not quite ready, you're okay with it.
Yes.
Okay. And I would say that goes along with the advice I give my patients. I admittedly am a softie when it comes to pacifier use and thumb sucking, because I genuinely feel like kids are only young for so long. It's such a short-lived period, and thumb sucking pacifiers offer them so much security and comfort, especially when they're tantruming or upset. It's such a nice, it's so nice for them just to put that thumb in their mouth and calm them down. So I feel bad, but I tend
function gets in the way. For example, I've had parents say to me, we're not getting anywhere with speech therapy.
Right.
And I know it's because the tongue isn't moving. So there are certain times where we'll want to intervene a little bit early on behalf of the child's well-being, but never for aesthetics.
And when you talk about the imprint of the thumb, the roof of the mouth, is that fixable? Is that permanent?
It's fixable.
Okay.
But it's a visual for them, and we'll show them at every visit when we do sort of an incremental desensitization plan. We'll show them, oh, look, that thumb is getting wider, or the thumbprint is getting wider. It's not there anymore. And they get really empowered by it. It's amazing to watch, specifically if you celebrate them for it, because it's a habit that they stop, that they're on their own.
Yes, I see. So it's more of you show them the thumbprint, not in terms that you're concerned for the future of their mouth development, but just it's motivation for them.
For them, it's motivation. I'm more concerned about the constriction of the mouth.
Okay. Just
from, again, a myofunctional standpoint. But I would never make a child feel bad about it.
Okay.
The one time that I will say with the bottle is if there's milk in it at night. Because even though there's not cavities at age 1 or 2, you are weakening that enamel going down the line. Because now these teeth are getting bathed in that milk all night. And so when parents say, how did she get all these cavities by age 7 or 8? We eat and drink and do everything so well. Well, they're weakened already from going to bed with the bottle for 2-3 years.
Right.
So,
and the bottles are so those can be so hard on the teeth, because the way I understand it is there's milk consistently on the teeth and there's no saliva that cleans it. Right.
And it's just a milk bath. It's just sugar sitting. It's the same with, for example, when babies are teething, and I see those mesh teething pads that have the fruit in it that people will place in the freezer or the fridge. I just don't support that, because they're bathing the teeth in sugar from fruit or any type of food. And there's plenty of different teething remedies that can work instead of that.
That's a great tip, because those are definitely in vogue. But you're right. You could do something without sugar, like I'll say take a washcloth, put water on it and freeze it, put it in the freezer, and then have the child chew on that.
I am careful though with freezer. We have seen cases of what we call popsicle paniculitis. What is that? It's when the inside of the cheeks burn. So we have to be careful. I like to tell parents, don't place it in the freezer, but place it in the fridge.
Okay. That's great.
Just because we have seen burns from that. It's not so common, but it's common enough where I get worried about it.
Okay. I love that. Thank you. I will change my advice now. Now, a question that comes up, teeth grinders. A lot of children that I meet will grind their teeth during the day, and some while they're sleeping. What can parents do to help with teeth grinding? The trickiest one for me is, what advice do you give parents for the nighttime?
So teeth grinding is extremely common, especially in the toddler years. If you hear your child grinding, I always say, make it a really zen environment. Before bed, practice what I call LTTA, lips together and teeth apart. And so
I'm trying to do
sort of like when in yoga you're told to rest your tongue on the roof of your mouth. So LTTA, I practice with the kids. I put their lips together, I massage their back teeth, and they're separated. So in a really calm way. And during story time, it should be LTTA. And the parent practices it and the child practices it. Right before bed, they go to bed, And we just say LTTA, remember, lips together, teeth apart.
So like this?
And sometimes if they fall asleep, a little less tight, not like that. More, very zen. Very zen. Very, very relaxed.
Okay.
Not forced. The whole point is that they don't go to bed already clenching.
Okay.
And at night, if you do hear it, just come behind and give a little release right there.
Okay.
Just a little bit of a massage. I've had parents who've put oil there. They said that different doTERRA oils helped. I don't know. But I will say that a little massage goes a long way.
And that's good to know that kids, that they do it when they're toddlers and that most kids outgrow it without any intervention.
Most kids outgrow, and those that don't, we then start looking at other factors.
Michelle, I'm just thinking, knowing how diligent you are as a brusher and flosser, your kids must have the cleanest teeth.
I thought so until their first cleaning. We try. But I can tell you that especially after birthday parties, we'll come in and I have little wipes in the car. They do wipe the teeth down. If it's a late night and we are at someone's house for dinner, then I do secretly take out a little tooth wipe and wipe their teeth, knowing they're going to fall asleep in the car. And I have occasionally been reprimanded for flossing them after they fell asleep.
I'm chuckling to myself because I'm remembering our last text exchange was you showing me your toothbrush in your car, and then I showed you my toothbrush and toothpaste in my car.
That's right.
Right.
The pre-pasted brushes are the best. The first time my kids saw me spit right before they were pulled up at car line, Mom, I go, what? This was my opportunity. I was brushing when I was car number 4 and 5. I spit when I'm car number 3. I pull you up at car number 1. Done.
You never know when you're going to need to brush. It's always good to be prepared.
Exactly.
Okay, so I thought I would end with dental emergencies. Do you have any advice? Are there any pediatric emergencies that parents should be aware of so that they can be empowered and know what to do if something were to happen? So, for example, I'm thinking of myself. We once went to a birthday party and my son fell and hurt his tooth and it was bleeding. Do you have any advice for parents so that they can be prepared should a dental emergency arise?
Well, first and foremost, just know the mouth is very vascular. What that means is even a little cut can look like a horror film. So do not freak out. First, wipe everything down. It may just be a little nick in the lip or a tiny little nick in the gum, first and foremost. Secondly, check how mobile the tooth is. If a tooth is shaking back and forth, yes, go see a dentist. If a tooth has avulsed, meaning it fell out, a permanent tooth, if a permanent tooth has fallen out, if your child is old enough, safest place to keep that tooth is actually in the cheek because the spit is in there. Otherwise, in some milk, and get to the closest dentist you can find. Doesn't have to be your dentist if your dentist is over an hour away. If a hospital is nearby, see if they have a dentist on call at the hospital. Most do, or most have at least an oral surgeon on call, and get that taken care of. Otherwise, dental emergencies can consist of, for example, a lip getting cut, a tongue getting cut, something getting lodged in the roof of the mouth. Be very careful with chopsticks at restaurants. That's a huge emergency that we see. Or utensils. You know, restaurants, everyone is busy. It's a group. They're talking. A toddler takes the chopsticks and it's a bad scene. So,
I've had a chopstick emergency where a kid was walking and it fell and it went literally through the back of the roof of the mouth.
Roof of the mouth. I had once through the cheek. We've had emergencies where food was lodged into the gum of a developing tooth. In that case, you really want to rinse well and call your dentist, who will probably say grab a water pick just to irrigate the area well. So first and foremost, though, see what's going on before you rush to a conclusion. And if it's a baby tooth that fell out, there's really not much that we can do. We've had parents run in with, holding the baby tooth, but we don't reimplant those. And if it's a little chip and the child isn't sensitive, just wait till the next day. We'll take a look at it. But if there's a break or the child is very sensitive and they're having trouble eating or breathing in cold air, then we can place a liner on there immediately.
So I love that tip that if a tooth comes out, to put the tooth in the cheek of your mouth.
And it's in the cheek of the mouth. If the child isn't swallowing it, I will say though, I've had parents put it in their cheek as opposed to their child's cheek. Not really the same thing. So you want to keep it in the mouth of origin.
Okay. And that keeps the tooth alive. Is that why?
It will hopefully make the tooth less likely to die later on.
Okay.
But it needs immediate attention. You definitely, if a tooth is out, you want immediate attention. And do remember, sometimes you think the tooth is out, you can't find it because actually it's been pushed up. We do have that happen where they're searching for this tooth forever, but it actually got pushed up into the gum. So we take an x-ray, we evaluate it, and I'd say there's always a solution. That's the best part about dentistry, is with teeth, we almost always have an answer.
I love that. It's true, and it's great optimism. It's true. Okay, so any last thoughts, any last minute tips for parents that you think would be helpful for them to be aware of that we didn't talk about?
It's important to stress oral hygiene because once the child is in pain, it's horrific pain. So I often hear, well, he just doesn't like it. We don't do it that often. We maybe get in once a week. If you start really young, as in from the first tooth, they get used to it. And if it is a child who really just won't let you in and parents say, well, we didn't want to force them, but now there's all these cavities, find a way, whether it's through videos, whether it's through games, whether you take turns, they brush your mouth, you brush theirs, to make sure that it's getting done. Because it is medical. It's not a game when it comes down to it. It's infection in the mouth that you really want to avoid. The goal is prevention, not easy, fun treatment, but prevention.
I love that. That's such a great advice to close on. I think that's such important advice to take to heart, that we have to remember that we're the parents. We know what's best for kids. And even if they're not interested in brushing, we have to be creative and think of a way to make it happen.
Right. And again, even if it's just a washcloth getting in there, it's got to come off. You can't leave food on there, and you can't let the gums get all puffy.
Michelle, it has been such a pleasure. Thank you so much for coming on. I hope I love talking about teeth with you. I hope we get to do it again soon.
Next time we'll just videotape the both of us brushing in our car in the morning.
Sounds good. All right. Thank you.
Thank you. Bye.